Hey, what's going on? It's Vince Geddes, a health insurance guy, and today I'm going to talk about a subject. Always talking about health insurance. That's what I do. But this subject is a little bit more in tune with a customer who called me, and they wasn't sure about a budget for health insurance. So I gave a scenario I thought was kind of ingenious. I had to pat myself on the back for this one. So what I gave was I asked her. I said, "Say, go to the marketplace, all right? Anybody can do this. Go to the federal marketplace, healthcare.gov. Healthcare.gov might not be available in every state, but the majority of states have healthcare.gov. Go to healthcare.gov and type in your information. Type in your date of birth, and then once you type in your information and your date of birth, um, you go right into you go right into um, the pricing of the plan, how much the pricing of the plans cost. Once you go into the pricing of the plans, you're able to see how much that health insurance plan costs. You may see a health insurance plan that may cost $400 or $500, whatever. Now, think about this as far as a business. Your employer, they still have to have health insurance for you, the employee. So what they do is they may take on half of the responsibility and get a tax write-off for providing you, the employee, with health insurance. You get it? So that, let's just say that $700 health insurance plan is now $350 for you, the employee, and then you have to pay for that health insurance plan either weekly or bi-weekly, however frequency you get paid, and then it's broken up. So that $350 might be broken up bi-weekly. So that's what it will cost you as an employee. Now, on the flip side, if you're looking for, let's just say, private health insurance, you know what I'm saying? Private health insurance is not going to cover the same thing that Obamacare covers. It doesn't cover for pre-existing conditions. Also, I don't mean to call it private health insurance. Let's call it short-term medical, because that's what it is. Short-term medical. It lasts for a certain amount of time. It is medical insurance. But again, it doesn't cover the things that Obamacare covers, or even a plan through your job cover, and it's minor stuff. It doesn't cover for pregnancy. It doesn't cover for anything before the deductible is met in most cases. But as far as Obamacare, it does cover for physicals. But once they do a physical on you and they find something on you, then you got to worry about all the other stuff that you have to pay for. The thing with a private health insurance plan is you got more flexibility, you got more doctors to go to, more hospitals to choose from. You can go to a specialist without a referral or short-term medical. So it has a lot more flexibility than the Obamacare plans. Obamacare is more so better for people who have pre-existing conditions. So if you have a pre-existing condition, you need to get on one of those type of plans because they're going to provide more benefits for you. Now, if you're a person that's healthy, you pretty healthy, you don't have any like pre-existing conditions, you don't go to the doctor that much, but you want to make sure you cover because we got a lot of shit going on now. It's COVID, cold and flu. It's a lot of stuff that's going on. It's starting to get cold. Then a short-term medical plan are probably the best thing for you to have. I just tried to break this down for you guys as easy as possible so that you, number one, understand how medical insurance is, so that when you decide what your budget is, because you can say the cheapest. I don't know what the cheapest is. The cheapest in my mind might be $1,000 a month. The cheapest in your mind might be $10 a month. I don't know what your definition of the cheapest is. Um, what I do is, when I'm looking for a plan, I try to find a plan that's going to fit your budget and your needs. Your needs is the most important thing. That's the reason why you're calling me for. You're calling me because you have a need, and I want to make sure that I provide the best service for that need. As far as pricing is, when I talk about money, it can become, you know, difficult for some people. I look at that as, saying it's, you know, it just depends, if it's important to you or not. People make room for what's important to them. So if health insurance is important to you, then, this would be something that you would take advantage of. If it's not important to you, then, risk it, roll the dice, see what happens, but, especially right now, where the hospitals are already, tight, and for someone to come in there with no insurance during COVID, and, the staff is looking slimmer and slimmer. It's, I would say get you some health insurance to cover your butt. But if you are looking for it, you can reach out to me at www.getnextdayhealth.com. That's www.getnextdayhealth.com. Or just give me a call at 404-689-2322. That's 404-689-2322. I'm licensed all over the United States, but I am based in Atlanta, Georgia. Let me help you find a plan that's going to fit your budget and your needs. Again, this is Vince Gaddis, the health insurance guy. I have real conversations with real people because I provide a real product that provides real solutions. Y'all take it easy out there. Peace.